Hello, my name is Dr. Renèe O'Leary. I am the project leader of the InSilico Science team there at the Center of Excellence for the Acceleration of Harm Reduction at the University of Catania in Italy. In silico science, our big project is to provide evidence of tobacco harm reduction, both with using systematic reviews and also with umbrella reviews, which are reviews of the entire systematic reviews that are out there. It's a rather new form and very, very helpful. In Silico Science is an ongoing project that provides evidence of tobacco harm reduction with systematic reviews and also with umbrella reviews. Umbrella reviews are overviews and analyses of systematic reviews. That's our whole purpose, is to provide evidence, to give evidence of that tobacco harm reduction that is available to us by leveraging the information that's already out there, the studies that have already been done. The point of this systematic review was to find human clinical studies from people who smoked and then substituted e-cigarettes, or also called ENDS. And these were the kinds of tests that you would see in a doctor's office, what they call spirometry tests. So that was the only thing we were looking for, human tests, not cross-sectional population studies of a moment in time, not animal studies, not in vitro or cell studies. We wanted to look at the best possible evidence, which is the actual clinical testing that comes out. So at the end of the day, when we searched, we found 16 studies that had 20 publications overall. In these 16 studies, we had 66 respiratory tests conducted before and after e-cigarette substitution, and 43 of those tests found no significant results at all, no changes of note. 14 tests showed declines in lung function, but 10 of those were from what we call acute studies, where you tested people immediately after using e-cigarettes. And all of the negative results, interestingly enough, were from studies at high risk of bias, studies we don't trust as well. There were 9 follow-up tests that showed improvements. The part that's also very important, that in every case, negative or positive changes, the results were really not clinically relevant. They only came up statistically by numbers, but if they showed up in a doctor's office, the doctor would not really care. It was not enough of a change. So at the end of the day, what that shows is that end substitution for cigarettes likely does not result in additional harm to respiratory health, which is very important, because when people have respiratory diseases, we don't want the disease to progress in any way if we can. What's different about our testing work and the work we do in our systematic reviews is that we are much more rigorous than the average systematic review. Of course, we assess for bias and quality. And so what we found was much of the research was low quality. Out of those 16 studies, 10 were at high risk of bias, and none of them were at low risk of bias. And also, unfortunately, many of the tests were very small numbers of people, 20 or less, and that's not really enough to show any sort of actual effect of happening. So that's a problem. But there were bigger problems too, which we looked at. Many of the studies had unexplained deviations from their protocol, their plan of research, and 3 of them were considered serious. Also, some of them didn't even have a protocol, which is astounding. The problem with this is that it can indicate that the authors were cooking the data. They were manipulating the data in a way to show it that the way they wanted, or that studies or testing that they didn't like didn't get reporting. And that was a very egregious problem in many of the studies. They only published selective test results, or they didn't even actually provide the actual test measurements. And finally, also, which we test for and look for in our studies, which very few systematic reviews do, if any, is to check for what's called reporting bias. That's very important in a field that's as fraught and as difficult as ours. So in many cases, the authors would only discuss the studies that supported their conclusions. Sometimes they just made the assumption that theirs was the only conclusion out there. And also, very often, in reporting bias, they would state that there was an effect when the findings were not significant. So all these things mean that the literature out there that we're trying to show as evidence is very poor quality. So our confidence in the findings is low. And also there's just not enough findings to be able to consider it a large database. So here we are at the end of the study. We've looked at these 66 tests, and we've come to the conclusion that there is no additional risk or additional harm that comes from N substitution. And that's important to know. As we continue with the InSilico Science projects, our current project is an umbrella review looking at 17, yes, 17 systematic reviews published on e-cigarettes for use in smoking cessation. This has always been the biggest promise of e-cigarettes, is that they would help people quit cigarettes. We have presented some preliminary results, and they're very positive that e-cigarettes are more effective for cessation than some of the other varicycline or going cold turkey. They're significantly more effective, sometimes is more than doubly effective. Of course, the sad part is e-cigarettes helping for cessation are only helping a very low rate of cessation overall. So that's what we're working on right now. That it will hopefully be out by the end of the year. The other smaller review that we're working on is looking at how when people substitute ends for cigarettes, what about their weight? Because it's very well known that when people quit cigarettes, they gain a lot of weight, as many as 4 or 5 kilos in 1 year. And our preliminary findings there is finding that e-cigarettes don't add additional weight on for people. And when they're used exclusively for cessation, the highest number we found was still a good 30% lower than what it works in other studies when we see people gaining weight. So the two promises of e-cigarettes do seem to have evidence for them out there in terms of improved cessation, no decrease in the number of quit rates, and lower weight gain. These studies will be coming out very soon.